In this figure, we're going to look at one example of autonomic tone, or push-pull, between the sympathetic and parasympathetic nervous system. Now, autonomic tone is when we have dual innervation by both of those systems at a particular target tissue, including cardiac muscle, smooth muscle at a variety of targets, or glandular tissue. Now, autonomic tone isn't consistent for all visceral targets, as sometimes there's only one or the other system innervating that target, but it usually does exist. And what it means, in our example here, we're going to look at heart rate, is that we have dual innervation, right? We have control by both systems at the same time. So in the heart, we have what's called an intrinsic heart rate, and that is that the heart has a pacemaker that, without any input whatsoever, neural or hormonal, would generate a heart rate of about 100 beats per minute right here at this arrow. Now, what we find is that in most of the population, the normal heart rate range is somewhere in the sort of 60 to 80 beats per minute. And what this indicates is that the parasympathetic nervous system dominates in most people at rest. And the degree to which it dominates will determine their resting heart rate. Now, note that it's dominating, but it is not the only system active, right? The sympathetic tone is way down here, while the parasympathetic tone is up here, much higher in a particular individual at rest. Now, when we need to change heart rate, as might occur during exercise, we would get sensory input that would stimulate a shift in the output of these two systems. And so as we can see, during exercise, we'd require a higher heart rate for a higher cardiac output, more blood flow. And what we would want to have happen is an increase in sympathetic output, which is stimulatory to cardiac muscle, a decrease in the inhibitory output to that cardiac muscle, and then of course we would end up with heart rates that are either at or above this intrinsic heart rate. Again, autonomic tone is due to dual innervation and both of those systems being active simultaneously to generate the activity level in that effector tissue.